Hello, doctor. How are you?
I'm good, Anshika. How are you?
I'm great. Thank you so much. So, today I wanted to ask you some questions that most of the pregnant women and new mothers have. So, the first question would be, would you recommend a pregnant women to work out during their pregnancy, or would you not recommend them working out?
Anshika, pregnancy is a special situation in life. That's all. You should exercise. You should continue exercising throughout the pregnancy until unless there are any complications and doctor has held you from exercising. If you have exercised before you became pregnant, you can continue exercising all those exercises which you are doing. And more than that, if you want to do additional exercises, it is always advisable to take, a consultation from your doctor,
Right.
whether you can do that.
Okay, thank you so much for your answer, doctor. My next question would be, when do you think is it okay for new mothers to start working out again? Like, if I've just delivered my baby today, for example, then when do you think is it okay for me to go back to my workout routine? Because I'm a fitness freak, and I'm sure so many mothers these days, they just want to go back to their original shape after delivering a baby. So when do you think is it possible?
So nowadays, the birthing techniques are so good and so safe. If it has been an uncomplicated birthing, whether vaginal birthing or cesarean birthing, you can resume your workout as soon as you reach home. You can start light exercises like walking, some breathing exercises, stretches, yoga. They can be resumed as soon as possible. I mean, if your doctor has given you certain advices on not to exercise, barring those, exercises can be started slowly, gradually, and build up your stamina and resume your exercises. If your pregnancy has been complicated, if your birthing has been complicated, if you suffered from any medical disorders, then take the advice of your doctor.
Next question that I'm going to ask you is very common these days, I believe. So many new mothers often complain of saggy breasts. Do you think that is a problem, or is it normal? How can one prevent it? Like, what's your take on it?
So majority of women have this myth in their mind that if they breastfeed their child, they will have sagging of the breast. It is not like that. I think breastfeeding is a beautiful gift of mother to the baby. It must be done. Do it properly. Sagging may happen if you're not wearing your inner wear properly.
Okay.
Or if you are not exercising your chest area properly.
Okay.
If you gain weight, if you don't take care of your health, then sagginess can happen. This can happen also when you stop breastfeeding and you're not wearing your inner wear properly. So it is important to remember only two things: exercise regularly. Secondly, you must wear your inner wear properly. So you can prevent sagging of the breast just by that.
When do you think is it okay for a new mom to start intercourse, like again?
So again, we have advised these women those 40 days of abstinence for the very simple reason that you are healing. If you've had a vaginal birthing, your vaginal scar is healing, your uterus is coming to normal size. So these 30, 40 days, if possible, intercourse should be avoided. Thereafter, it can be resumed if you've had a complicated pregnancy, or there are certain special situations that doctor has prevented you from having it. Barring those, it can be resumed as soon as your 6 weeks of involution are completed. Please remember to ask about contraception from your doctor as soon as you resume intercourse.
Thank you so much for your time, doctor. I just want to bring one thing to your notice. I was actually delivered by you. You were the one delivering my mom. And thankfully, she's been fit and fine all throughout her life. And all thanks to you, doctor.
My pleasure, Anshika.
Yeah, thank you. Have a great day.